Hello and welcome to Pharmacology Success. In this video, I will explain the pharmacology of heart failure. Heart failure is a progressive disorder in which the heart is unable to pump sufficient blood. Its symptoms are dyspnea, fatigue, and fluid retention because it is often accompanied by abnormal increase in blood volume and interstitial fluid. 7 classes of drugs that have been shown to be effective for heart failure are angiotensin converting enzyme inhibitors, angiotensin receptor blockers, aldosterone antagonists, beta blockers, diuretics, vasodilators, and inotropic agents. Starting with ACE inhibitors, the drugs in this group are captopril, enalapril, fosinopril, lisinopril, quanipril, and ramipril, and they block the enzyme that cleaves angiotensin 1 to form the potent vasoconstrictor angiotensin 2. ACE inhibitors decrease afterload and preload, resulting in increased cardiac output, and this improves clinical signs and symptoms of heart failure. Angiotensin receptor blockers like candesartan, losartan, telmisartan, and valsartan are competitive antagonists of the angiotensin 2 type 1 receptor, and their use in heart failure is mainly as an alternative to ACE inhibitors in those patients with severe cough or angioedema. Aldosterone antagonists, which are spironolactone and eplerenone, prevent salt retention, myocardial hypertrophy, and hypokalemia, and they are indicated in patients with more severe stages of heart failure and recent myocardial infarction. Beta blockers prevent the change that occur because of chronic activation of the sympathetic nervous system, and 3 beta blockers have shown benefit in heart failure, which are bisoprolol, carvedilol, and metoprolol. Carvedilol is a non-selective beta antagonist that also blocks alpha-adrenergic receptors, whereas bisoprolol and metoprolol are beta-1 selective antagonists. Beta blockers are recommended for all patients with chronic stable heart failure, and they reduce the patient's morbidity and mortality. Loop diuretics, which are furosemide, bumetanide, metolazone, and torsemide, are the most commonly used diuretics in heart failure, and they are useful in reducing the symptoms of volume overload, including orthopnea. Diuretics decrease plasma volume and subsequently decrease preload. This decreases cardiac workload and oxygen demand, and they may also decrease afterload by reducing plasma volume and thereby decreasing blood pressure. Nitrates are commonly used venous dilators to reduce preload for patients with chronic heart failure, and arterial diureters such as hydralazine and isosulfite dinitrate reduce systemic arterial resistance and decrease afterload. If the patient is intolerant of ACE inhibitors or beta blockers, or if additional vasodilator is required, a combination of hydralazine and isosulfite dinitrate may be used. And the last class of drugs that can be used for heart failure are the inotropic agents. Drugs in this group are the digitized glycosides, which are a group of chemically similar compounds, and the most commonly used drug is digoxin, and beta-adrenergic agonists like dobutamine and dopamine, and also phosphodiesterase inhibitors like milrinone. Drugs act by different mechanisms, but the inotropic action is the result of an increased cytoplasmic calcium concentration that enhances the contractility of the cardiac muscle, increase the cardiac output. Thank you for watching. See you in the next video.